Good afternoon, everybody. Thank you so much for joining. Excited to go over some grants overview. So we'll go ahead and get started here. Next slide. All right, so going to go over the slide here. The grants implementation and oversight, it is seen by many different internal teams and so forth. So we have our finance team, Office of Business Intelligence, provider monitoring, health plan operations, network management, workforce development, systems of care, marketing and communications, and our clinical ops team. A lot of people oversee this. So block grant overview. What is a block grant? It's a non-competitive formulary grant mandated by the U.S. Congress. You must submit an annual application. The SAMHSA is responsible for two grant programs. First one is the Community Mental Health Service Block Grant, or MHBG, as some of you may have heard us refer to as before. And then the next one is our Substance Abuse Prevention and Treatment Block Grant, or SABG. We normally go by the acronyms when we refer to these grants. So as we continue in our webinar here, you'll be seeing me and hearing me most likely referring to the acronym. So just an FYI there. So we're going to start off with the Mental Health Block Grant. All right. So what is the purpose of the MHBG, or the Mental Health Block Grant? It provides funds and technical assistance. Funds are used to plan, implement, and evaluate activities that support and treat adults with seriously mental illnesses, children with serious emotional disturbances, and persons experiencing first episode psychosis. The population it serves. So MHBG is available to provide mental health treatment services to uninsured individuals within these populations. So the first one here is the seriously mental illness, or SMI, as some of you may know it. So it's adults 18 and above, persons who have a diagnosable behavioral, mental, or emotional condition. Next one is the serious emotional disturbance, or SED. This is for children up to the age of 18, person up to the age of 18 who have diagnosable behavioral, mental, or emotional issues. And then the first episode psychosis, or FEP. This is for ages 15 to 30. Diagnosis may include schizophrenia, schizoaffective disorder, or psychosis disorder not otherwise specified. All right, now we're going to go into the Substance Abuse Block Grant. Next slide. So what is the purpose of SABG, or the Substance Abuse Block Grant? It provides funds and technical assistance, funds to plan, implement, and evaluate activities that prevent and treat substances used and promote public health in Arizona. Available to provide substance use treatment services for those with a substance use disorder, and for adults and youth that are uninsured or underinsured. Next slide. So the priority populations for SABG is pregnant women or teenagers who use drugs by injection, pregnant women or teenagers who use substances, other persons who use drugs by injection, substance-using women and teenagers with dependent children and their families, and all other individuals with a substance use disorder, regardless of gender or route of use. Next slide. So before we go into the reference and sources, I want to kind of pause here for just a minute and let everyone know that in order to be an MHBG or SABG grant provider, it is basically a closed network at this time. We have allocated out the funding for FY23. However, if you are interested in possibly receiving grant funding, you can definitely submit a letter of interest to us and we can review it and so forth. It will go through the proper channels and be reviewed. We cannot guarantee anything, but it is out there for providers. So next I'm going to go over references and resources. Next slide. So for MHBG and SABG, for these members, in order for them to be able to bill for providers to bill for those services, the member needs to have a non-title enrollment. So non-title enrollment are intended for persons without Medicaid benefits but are otherwise eligible for publicly funded behavioral health services. So the non-title enrollment, it is actually done through our web portal itself, and then it comes over to us, we review it, and we approve it, and then you guys are good to go ahead and bill for those services under either MHBG or SABG. And we do have a link here that walks providers through the non-title enrollment process. And this slide deck will be sent out to you for after this webinar, so you have it for your references. Next one. Connect members to care. So members can get connected to grant-funded services in two ways. First one is the Mercy Care REBA member services. You can definitely call in to any of these numbers here, and they will tell them that you're interested in block grant providers in your area, and then they'll be able to see which providers are in your area and will refer you and provide you that information. And then you can also visit our grant website page below for a list of providers and contact information for referrals. Next slide. Policies and community resources. So these are really great to look at. So for policies, we have an Access Block Grant Q&A. We have an Access Grant webpage. We have an Access Medical Policy Manual. And then for the community resources, we have a Mercy Care list of community resources, as well as the Mercy Care's Medication Assistance Treatment webpage. So those are really great resources to look at and so forth. I definitely recommend that you all take a look at this. I refer to it when my providers have questions for me, so I bounce this information back to them to let them know as well. Next slide. All right, so our grants team contact information. So Matt Joya is our clinical operations admin, and I know he is online, so if I said that incorrectly, Matt, I do apologize. So Matt actually oversees the grants. He is the main guy for our grants for Mercy Care. And then he has a few team members under him, which is Devon Leakey, Jarrett Rice, Lauren Retson, and Karen Haig. And then they also have a team email as well in case you may have questions and so forth. You can always reach out to them through the team email, through your network management representative, or to them individually. Next slide. Okay, so the grants department. So as it was mentioned before, Matt is our grant administrator, so he oversees everything. He oversees MHBG, SABG, our SOARs, the eCOVID-19, the CBHSF grant, the GOSA, PPW, PLT, the COP, ARPA, and then the CURSA. So he is the main guy. And then we have it broken down to kind of who oversees like MHBG or SABG and so forth. So for Devon, she would oversee the MHBG. We have Jarrett Rice, who oversees the mental health block grant as well for SMI treatment coordination. Lauren Reed, she oversees the substance abuse block grant or the SABG. And then Kendra Peg, she oversees the MHBG SAD treatment coordinator. And then Lauren oversees the ARPA. So they all oversee one of the grants that we offer here at Mercy Care, and they are super knowledgeable and will provide you with any answers you may need to your questions. Next slide. Okay, so at Mercy Care, we have a bunch of terminology that we use, and we use acronyms for a lot of it. You may have seen some of these before. Like I said earlier, this slide deck will be sent out and you will have this information. So if you happen to see that we come back saying access or MHBG or OIFA or SMI, you know, here are the definitions of what we're referring to. I know some acronyms can have multiple meanings and so forth, so we're just breaking it down to exactly what we are meaning when we're responding back and so forth, so we're all on the same page. Next slide. All right. The Access 300 2B medical policy manual here, you may, for those providers that currently receive SABG or MHBG, you are very familiar with this or should be. This is a great tool to refer to when you're wondering if a certain service may be covered or not, if it's covered under the mental health block grant, or if it's covered under SABG, and so forth. And then depending on the members, if they're SMI or if they're SED or SUD, this is a let you know if the service that you're providing is covered under this or if not. So there is a few pages to this. As you can kind of see, Tara will probably scroll through, and it'll say, no, it's not covered. Yes, it is covered, and so forth. So it's a great tool to have. We refer to it probably on a daily basis. It's a great resource, and it can be found online, but like I said, we'll send this out to you guys. So we'll keep going here. All right. So currently, this is a list of those that of providers that have the mental health block grant with Mercy Care at this time. If you are a newer provider to us or may not receive mental health block grants, if you have a member that happens to come and is looking for services and they are not insured, but would qualify for the mental health block grant, and maybe you do not receive that funding at this time, you can definitely refer that member to any one of these providers here. We will, like I said, we'll send this out so you'll have it for your reference, but this is a list of all of our children providers. And then the next slide will be for our adult providers for MHBG. And then also for the first episode psychosis providers as well. So you'll know who you can contact and so forth for MHBG providers. And then our next list here is we have our substance abuse block grant providers listed here. So if you happen to have an adult that may need services that are uninsured or so forth, and you may not have that, that grant, you can refer them over to these providers that you see on the screen. So for residential treatment providers, we have a few listed here, as well as for outpatient treatment providers and our opioid treatment providers as well.